Have you ever heard someone describe a person who seems to be acting very differently, sometimes saying they have a split personality? It is a common phrase we hear in movies and everyday conversation. But when it comes to mental health conditions, is there a specific illness linked to this idea of multiple selves? No, people who live with schizophrenia do not have two personalities. This is one of the most persistent and damaging myths about the condition. Schizophrenia is a complex brain disorder, not a split personality or multiple personality disorder. The misunderstanding often comes from the word itself. Schizophrenia literally means split mind, from the Greek words schizine and phren. However, this term refers to a split from reality, meaning a disconnection between a person's thoughts, feelings, and behaviors, and their perception of what is real. It does not mean someone has two separate identities within them. That particular condition, where a person experiences distinct identities or personality states, is actually called Dissociative Identity Disorder, or DID, which is entirely different from schizophrenia. Understanding this distinction is incredibly important for everyone. When we use the correct terms, we help reduce the stigma surrounding mental health conditions. Instead of thinking about split personalities, focus on the actual symptoms of schizophrenia, which can include things like hallucinations, hearing or seeing things that are not there, and delusions, which are strong beliefs that are not based in reality. People with schizophrenia might also experience disorganized thinking or changes in their emotions and behavior. This clarification helps us move past harmful stereotypes. Knowing that schizophrenia involves a disruption in thought processes and perceptions, rather than a dual identity, changes how we approach support and treatment. It emphasizes that this is a neurological condition affecting the brain's functioning, rather than a character flaw or a choice. Recognizing these true symptoms allows for earlier intervention and more effective support systems. By understanding that schizophrenia is a brain disorder affecting a person's connection to reality, and not about having multiple personalities, we can foster a more compassionate and accurate view of those living with the condition. This knowledge empowers us all to challenge misconceptions, promote genuine understanding, and support individuals on their path to recovery and well-being.